and now it is time for the injury report here on the Pat and Aaron Show.
Speaking of X Factors.
By Florida Orthopaedic Institute in partnership with Tampa General Hospital. That X Factor we speak of is our good friend, Dr. Jeff Sellman. Dr. Sellman, good to have you aboard again.
What's up, Doc?
Hey, man. Thanks for coming. Or me coming back.
I was going to say, we were here. We just brought you on. Yes. Listen, good things having you on. Bad things for Rashaad Penny, running back of the Seahawks. He's out for the season with a broken fibula in that loss to the Saints. He's going to be undergoing some surgery here. Season is over. What's the recovery for this injury? And talk about the difference between, we hear the fibulas, the tibulas, and the ribulas. Speak of the difference on those. I made up ribula.
There is actually a big difference between the two, and it is the size and actually the weight-bearing status of each one. So there's two bones in our lower leg. One is the tibia, not the tibula, which we love to hear, and the other one is the fibula, which is the outside bone that is actually non-weight-bearing.
My bad. I thought it was tibula.
Yeah, I know you did. But I always give a free pass to those. You know, it's like the Rotary Cup of the Rotator Cup. It's all good.
When it comes to leg bones, obviously there's some of the larger bones in our body. When it comes to breaks, is it easier for a large bone to heal and get strong again, or is it more difficult and take longer because of the size of it?
That's interesting. If it's the bigger, of course, we like bigger bones. But if it's a bigger bone and it's weight-bearing, it actually is more quickly to respond to recovery because when you're walking on it, and that's the signal for the bone cells to start turning over and chugging out new bone, and that's a good thing.
Russel Wilson, he has had a rough season so far, and now he's dealing with that shoulder injury, partially torn lat muscle. How long, with what you've been seeing, what we've been seeing with Russell Wilson, it seems as if it's really having a big impact here. What's rest going to do? How do you manage an injury like this without getting something like surgery?
Oh, man, I think we should change his name to Russel Wilson because of the rough nature of it. But it's definitely a rough one to actually recover from because of the nature of that particular muscle and the stability of it in terms of both the trunk, the chest area, and the shoulder. Resting it is actually counterproductive but also productive. So you have to walk that fine line between not resting it enough and resting it too much in order for the muscle to start losing function if you rest it too much. So it's going to be a little longer recovery for him because of not only his history but also the location of that injury.
And how much more difficult is it? You know, you guys obviously specializing in sports medicine a lot of times for athletes. If you're talking about whether it be a high school quarterback or a guy Russell Wilson's age, for someone who has to throw the ball or use their shoulders and their arms in kind of an unconventional way that the rest of us don't have to do walking around on a day-to-day basis, how much more difficult is it for someone like that to heal, not just to the point where we all want to be healthy, but also to the point where they can use that athletically again?
Oh, 100%. It's a much longer recovery. Not only the muscle may itself be actually healed, but to get to that high level of play and the high athleticism will take a lot longer in the function for it to actually come back to where it was before rather than just lifting a beer off the table.
Which it can be challenging for some, Dr. Sellman. You'd be surprised.
Well, after about 6, maybe.
Panthers Baker Mayfield, he was examined for an ankle injury during the game. He finished the game but was in a walking boot afterwards, and he's not going to go this week. But that's used. He had the walking boot. What is that, to reduce the swelling? What's the ankle injury we could be looking at here?
More than likely just a typical sprain of the ankle itself, but of the ligaments around the ankle. And the walking boot does a couple things. Number one, like you said, it does do some compression to reduce the swelling, but also kind of gives a little relative rest. So you're not actually moving the ankle a lot when you're walking, and it gives a little bit of less usage of those injured soft tissues.
Plenty of work on that ankle when you're trying to make a 3 or 5 step drop, though, right? So how much more difficult is it for a quarterback who has to use those ankles like that, and it's such a big part of every single play, at least every single passing play for a quarterback?
Oh, man. I mean, it's going to be tough. There's even just regular ankle sprains for regular people walking around can take months for it to actually feel back to normal again. So in order to take a 3-step drop is going to be really difficult for the next couple months for him. He's going to probably feel it no matter how much taping he's going to have.
Dr. Sellman, my back hurts.
Oh, boy. Why are you rubbing your elbow?
Oh, I have a strawberry from the softball game last night. But in general, my back hurts. I don't know. Am I sitting too much? Am I laying down too much? Like, what do I got to do here?
Got to lay on your stomach.
I think I do when I sleep in the middle of the night. I start on my back and then I go to my stomach.
Actually, it's funny. It's actually you should be laying on your back or your side a lot more than your stomach. But if your back hurts, you got to get to the gym, man. Come on now, you got to get those abs. Look at your abs. Can you see your knees? If you can't, then you got to start working on those abs a little bit.
I've been going to the gym, but maybe I've been working on the wrong stretches here. Got to talk to my trainer.
Yeah, going to the gym does not mean going back to a yoga class and just watching the stretching.
He knows me so well.
He does.
Tyreek Hill, before we let you go here, Tyreek Hill, he's dealing with a foot injury. Came into the game actually last week dealing with a quad injury, but had that foot injury late. He was in a walking boot. Could that have anything? Could those have been hand in hand with a quad injury leading to the foot injury, which we kind of talked about before?
Yeah, hand in hand or foot in foot. Everything is connected in the human body, and absolutely could favor that particular side when you have an injury upstream from what the actual new injury is. So absolutely could have a connection to it for sure.
Hey, Doc, how often do one of your patients look at you and say, blank hurts, and then just expect you to know everything about their lifestyle and what they're doing wrong?
Every day, and I wish we didn't discontinue the masks in clinic because I have to mouth some things, and I have to stop mouthing those things. And I have to tell them, well, I can't tell you what's hurting. Your face is hurting me right now.
Fine. I won't bring up my back anymore, Dr. Sellman. Just fine. We love having Dr. Sellman on. The Pat and Aaron Injury Report was presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. Great work, as always, Dr. Sellman. Really appreciate you joining us.
Hey, thanks. And one last thing, October 22nd, the men's lacrosse team at UT everyone is welcome to buy a ticket, is celebrating the national championship.
Nice.
I love it.
And that's my alma mater, so I'm very happy about that. Thank you, Dr. Sellman.
I knew that. That's why I had to plug it.
Good plug. Thank you. Go Spartans. We'll talk to you later, Dr. Sellman.
Thanks, Doc.
All right, see you.
He's the best.
Lacrosse was just coming into, it was starting to get popular when I was in school, and then when I got out, I was out as well.